Stephen Cagle, good morning. The surgeon who is also the chairman of the Oklahoma City County Health Department. You've worked in Africa. People talk about this thing may be completely out of control, but public officials have got steps to take care of this, to stop it. You've been in Africa. You said if it was really contagious, as some of the media have suggested, there would be no Africa.
You're right. Anything that has a 50% mortality has to be taken very seriously. However, you have to take the overall context, and that is, how is it transmitted? If this were transmitted through the air like influenza, it would be so much more deadly. But I'm not minimizing it, and the state has taken this very seriously. Our emergency preparedness people are all over it. We have a hotline. We have information. Every day we're sending reports to our director. We're working with the state and Tulsa health departments, and all the hospitals are on board. We are ready for anything that happens, but I'm prayerful that it won't happen. I don't expect it to happen.
All right, so we've seen some sensationalism about this. Some people still talk about it airborne. The science says it's not airborne, correct?
That is correct.
So what are we doing in Oklahoma County, for example? You mentioned even the airports are involved in this. You have an early warning system, right?
Yes, our epidemiologists are surveying multiple groups that give us information. So if there's any sign of an adverse set of symptoms coming, we will react very aggressively to that.
All right, so there has been sensationalism in the media, and so it goes, but for folks that want to be careful, all right, still say they don't trust the government. What does a person do to prepare themselves or to be wary of what goes on in terms of this particular virus?
As with any infectious disease, sanitation is critical. Hand washing, avoidance of places where there are diseases, careful what you pick up, what you eat, what you touch. But I think that's fine. I think that's plenty. I've had friends ask me if they can go to Dallas for the OU Texas game, and I say by all means, go to Dallas.
What you just said would also work for, colds and flu and all these others. By the way, people still need to get their flu shot, right?
Absolutely.
So what do we take away from the coverage that has happened? I mean, as we look at infectious diseases, there's a new one all the time, right? Or they come back around. Is public health difficult to get good information out on without being sensational?
Well, sensationalism does sell, and it's good to show that we are prepared for anything that comes, but we're prepared for mundane things, mild infectious disease outbreaks like flu. We're encouraging shots for that. We're encouraging all immunizations, and it's part of our health and wellness that dominates what we do at the health department.
One of the things that you folks do down at the City County Health Department is talk about wellness. What is that?
Wellness is diet, exercise, medical prevention, taking your heart medicines, controlling blood pressure, control your diabetes, all the usual things. It's nothing too mysterious.
All right, we're going to put up on the screen right now. There's occhd.org is what you can get information about this. There's also a hotline, 419-4111. If you need some information about it, the people down there will take care of you and reassure you and let you know what the facts are.
Absolutely. The website's excellent. It'll give you more information than you'll want to read, but it's excellent, and it's worth looking at.
All right, Dr. Stephen Cagle, Chairman, City County Health Department, thank you very much.
Pleasure.